Hi there, and welcome to the Enough is Enough YouTube channel. In this video, I hope to share with you a study that I found early on when I was looking into Dr. Chetty's approach to dealing with COVID-19. I really wanted to find any evidence that others around the world had been approaching COVID-19 from the same perspective that Dr. Chetty was. I recognised that his approach was unique. He was separating it into two different pathologies. He was looking at the virus and its symptoms, and then looking at the second set of symptoms that were more serious and causing more problems, and he was seeing it as an allergic reaction. So I basically wanted to find out if anyone else in the world was treating COVID-19 in a similar manner. Now, I didn't find much. Most people don't think of the virus and the symptoms in that way. But I did find one study. It was in fact the very first study that I found, and completely independent, separate of what Dr. Chetty is doing, but remarkably similar in some of the results. So I just want to share that with you. So this report you can access for yourself. I'll put a link in the show notes down below. But if you venture over to the Pulmonary Pharmacology and Therapeutics Journal website, you could do a search for it. It was posted up there in January of this year, and you can download a PDF, which is what I have done. So just to give you a sense of what they were doing, this study it's an observational study, and it comes from the very early days of COVID-19. So the virus would have hit over there, I think, March 2020, and obviously they would have been aware that this is hitting communities all over the world, and they, the management of this facility, were looking after at the time 90 patients with an average age of 85, plus a staff of about 64. Now, in the first 6 weeks, so up until mid-April, they lost 6 patients fairly quickly to this disease. But about mid-April, they decided to implement their own treatment protocols, which they based on their extensive experience with both allergies, a lot of allergies in that area, and severe respiratory infections. They'd also had quite a bit of experience in dealing with people that suffered from that. So they chose 2 primary medications. The first was antihistamines. They had used them extensively, and they were very aware that they had a very high safety record. And apparently they felt you could even increase the dose based on the recommended doses to up to 4 times without causing any real issues. So that was their first choice. Their second choice was some certain antibiotics that they had used successfully in dealing with those lung infections. So that's pretty much what they chose. They also chose to educate. So they educated their patients on what to expect, gave them some exercises to do. They educated the carers on what the process would be, and then they went to it from mid-April. So straight away, about 25 patients had symptoms, and so they isolated those patients in their rooms, and so therefore cared for them with the antihistamines straight away. And if they needed additional medication, they would obviously provide that too. They also went on to provide antihistamines prophylactically to all the other patients. So they all got antihistamines. And the carers also, who had a face-to-face contact, they also gave them antihistamines as well prophylactically. So before any symptoms, they were already treating them with these antihistamines. So for the next, all through May, up to the end of June, they went about their treatment protocol. Now, throughout that period, they came to a point where everybody had recovered. No one had any more symptoms, and everyone who had been sick was no longer sick as far as they could tell. At that point, they tested everybody's blood, and they found that all the patients had a serology that tested positive to COVID-19. So they'd had COVID-19, and half of the staff had had COVID-19. But throughout that period, they had had no hospitalisations, no oxygen, and no one had died. So basically they had made it through COVID-19, through that wave of it, and all they had used were antihistamines, and when necessary, an antibiotic. That made me sit up and take notice. That sounded remarkably similar to what Dr Chetty was doing. They were providing medications that dealt with this allergic reaction, this allergic response. And because they dealt with it immediately before even symptoms showed, it may well be that that masked these allergic responses and reactions. Whatever happened, in whatever event, the reality was they were incredibly successful. Now, when you go through the statistics for the same area, Spanish statistics on elderly nursing homes, they should have had 25 deaths, but they didn't have any. So that is a remarkable result that they have had. Now, I share this with you because it just bears some very strong similarities to what Dr Chetty has been doing. So I encourage you to read it for yourself, to have a look at it. I found very little comment on this study, the same as I found very little comment on Dr Chetty's approach. I did find one paper that referenced it, but it was all in Spanish, and I can't read Spanish, so I wait for a translation of it into English so that I will know. But very little other reference to it. And I have found in my studies, granted it's only been 3 or 4 weeks, that others have looked at antihistamines as part of a treatment regime. But generally speaking, even though they have said that there are some positives there and it's worthy of further investigation, I struggle to find anyone who has taken it much further. But even the context, even the way they describe their studies, I still get the distinct impression that they are not thinking allergy, they are thinking virus. And so therefore their findings are, they're not, I don't know that they're taken as seriously as what they could be, because I guess unless you approach it as an allergy, you don't necessarily see the validity of the connection. So look, I share this with you for your own research. Please keep looking into it. And look, if there is truth and validity to it, then hopefully more people will know. Hopefully more doctors will find out and will investigate, and maybe even our governments will listen at some point. So thank you for sharing the video with me, and I look forward to seeing you again. Thank you.